Next we'll have, is it Genia? Genia. We have Genia Lindsey.
Hi, sorry I'm late. I was a NASI intern last summer, and I loved my experience with NASI, so I don't know who all in here is a NASI intern, but it's a great experience. Right now I'm working at the VA's National Center for Ethics in Healthcare, and I would say my experience at NASI really helped me get this internship, which I like a lot. And to the rest of you that aren't NASI interns, what I would say to you is the work you're doing now at your internship, while it seems mundane and like boring and blah, 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 I know we all have those moments, really what you're doing is building your resume, you're gaining so much knowledge, and it's going to help you in your next steps. So I would emphasize, don't look at what you're doing as, even though sometimes it can be trivial, it's really building on where you're going next. It's setting your track. That said, I would say also the broader context of your understanding of social insurance policy is really going to be beneficial. Where I see it most evident is in the current health reform debate. I think you guys spent the last hour or 2 hours or so looking at these ideas of shared notion or shared responsibility. How much society should play, what role should the rest of us play in caring about each other's health care. Well, you see that in Social Security, those very same ideals. How do we protect against the unexpected? Who should pay? At what level should we pay? What benefits should we get? These are all principles in the Social Security program that you see right now being fought over in the healthcare reform debate. And I think in any sort of domestic policy debate, you're going to see those same ideals. And studying them now within the context of Social Security, the Social Security program, yeah, the program's already going, and those aren't really the things that are being fought over now, but they still play a huge role in what's going on right now and what will come into the future. So really put some thought into how much of a role should we play in paying for other people's security, whether it be income or healthcare. So those are kind of my thoughts, and I'm more than happy to answer questions about anything.
Alrighty, let's thank our panel.